It's time to step up, prep up.
Step up, prep up.
To help keep you free from the risk of HIV.
From the makers of Truvada, there's another PrEP option, Descovy for PrEP, a once-daily prescription medicine that helps lower the chances of getting HIV through sex. It's not for everyone. Descovy for PrEP has not been studied in people assigned female at birth. Talk to your doctor to find out if it's right for you.
Step up for health and body.
Prep up for your one and only love, or many loves.
For kings, this queen, and you royals in between.
For my now.
Our now.
And my future.
Our future.
Step up, prep up. Descovy is another way to prep. Descovy does not prevent other sexually transmitted infections, so it's important to use safer sex practices and get tested regularly. You must be HIV negative to take Descovy for PrEP, so you need to get tested for HIV immediately before and at least every 3 months while taking it. If you think you were exposed to HIV or have flu-like symptoms, tell your doctor right away. They may check to confirm you are still HIV negative. Serious side effects can occur, including kidney problems and kidney failure. Rare life-threatening side effects include a buildup of lactic acid and liver problems. The most common side effect was diarrhea. Tell your doctor about all the medicines and supplements you take, or if you have kidney or liver problems, including hepatitis. If you have hepatitis B, do not stop taking Descovy without talking to your doctor. Ask your doctor about your risk of HIV, and if Descovy for PrEP is right for you.
Words are loud, but actions are louder.
Step up,
Prep up.
With Descovy for PrEP.
Get help paying for Descovy for PrEP. Learn more at stepupprepup.com.
Hello, DMV community stakeholders. My name is Miguel McInnes, and I'm the CEO of Metro Health. And welcome to the All Boys Aren't Blue, a memoir manifesto, town hall discussion. And we are the proud sponsors of today's discussion. Let me tell you a little bit about Metro Health. Metro Health is a community health center located in the Washington, D.C. area, and we've been providing families with better living and better lifestyles for over 30 years. And thanks to our leading healthcare services relating to hypertension, diabetes, obesity, and HIV, we have been working to ensure that our Black and Brown sisters receive the needed HIV services, as well as essential and substance abuse services that our communities deserve in order to have a fighting chance to rid the health disparities that are disproportionately impacting our underserved communities. Well, we know that when this happens, nationally, we'll begin to experience nationally, they'll experience what we've experienced here in the DC area, what we know as the Metro Health experience. And that involves access to quality primary care and behavioral health services, as well as the needed essential services that support the whole person. Well, let me introduce you to our moderator, Dr. Helen Holton, and she's the executive director of NOBCO. And Dr. Holton?
Miguel, thank you for that fabulous introduction. Good evening, everyone. I'm Dr. Helen Holton, Executive Director of the National Organization of Black County Officials, and I am so glad you're here with us this evening. You're going to just love, love, love this film, All Boys Aren't Blue. I have to tell you, when I first heard the title of it, I couldn't figure out what the heck they were talking about. But you know what? Anytime iN-Hale Entertainment comes out with a production, I'm sure it's going to deliver something worthy of my time and effort. We definitely want to give a special shout out to George Matthew Johnson, and you'll understand the emphasis on Matthew once you see it, for an incredible story. It's right in line with Nathan Hale Williams of iN-Hale Entertainment and how he just brings these stories to life. Here's the important thing, two things I want you to really take away from this. Number one, stigma's gotta go. We don't have room or space for it. It is probably the single most thing that I know that stands in our way of doing and being who we are as a community. The second thing I want you to keep in mind, community is our superpower. And the more we gravitate and know that, the better off we are. So sit back, if you got popcorn, a beverage, whatever, and get ready for this film. Because on the flip side of it, the message is this: get tested, know your status, get into treatment if you need it. And the goal is to get to the point of being undetectable. And it is possible. This filming tonight is specifically focused on those of us in the DC, Maryland, and Virginia area. more affectionately known as the DMV. And we're bringing it to you because it's just a powerful piece. And we know that our numbers in this area are some of the highest in the nation. But we're going to do this now. Enjoy the film. At the end, we'll certainly give you some resources that you can tap into to know how to do better. And then we'll have a panel discussion right after the film to even go a little deeper on why this is so important and why it matters to you and our community. So thank you, and thank you again. Enjoy.
Now, I know you just had the baby, and Gregory said the baby's name's gonna be George.
I was 5 years old when my teeth got kicked out. It was my first trauma.
I always thought it was funny that my grandmother had 3 last names. To me and the other grandkids, she was simply Nanny.
I was depressed at the start of second semester. I was having fun, but deep down inside, I hated myself.
2 others grabbed me by the arms and held me on the ground. I screamed for help as it was all I could do.
I had a home because Nanny ensured it. When Nanny wanted something done, it got done.
I gave her the biggest smile I ever had since the day I lost it.
Our chapter was established by a founder of the frat in 1907, making us one of the oldest chapters in Black Greek history.
No amount of money, love, or support can protect you from a society intent on killing you for your blackness.
It was time for me to define me.
Hello, 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 everyone. We are so happy to have you here with us today. I certainly hope you enjoyed watching All Boys Aren't Blue. Wasn't it just phenomenal? Such a powerful piece that we did. And so we decided it was worth it to come back and have a discussion about what this film means, what it means to our communities right now today. And I want you all to meet our panelists today and participate in our conversation because it is definitely one worth having. So let me introduce our panelists today to talk about this phenomenal piece of art, education, and entertainment. Let me begin with Randy Woods, who is one of the directors at Sisters Together and Reaching from Baltimore, Maryland, a wonderful, powerful organization that I've known personally for more than 20 years. They just do a phenomenal work in the community. And we're also joined by Andrew Teal from the Bennett Career Institute and the C. Allen Foundation. Powerful brother, C. Allen, who does some work in the DC metro area. We also have with us today Raheem Briggs, President CEO of Project Briggs, another powerful organization supporting our efforts in our community to eradicate and get people the help and resources they need in this fight to end HIV, especially in our community. And rounding out our team is Valerie Rochester, Senior VP with AIDS United, another strong, powerful sister that I've been in the trenches with doing this work to help women in particular to realize, Black women, because when you look at the statistics all around, it matters. It matters most in our community. What we want you most to walk away from this is, number one, when you're talking about how powerful this film is and helping other people to understand why they need to see it, we want you to use that hashtag, Stigma Gotta Go. Hashtag Stigma Gotta Go. And also to understand this, in our community really is our superpower. And we're going to talk to you today about why that's so important to us. And so what I want to do is I want to lead off with Raheem. And before we get going, I want everyone to think about this discussion is being brought to you and the showing of the film by Metro Health DC. And they do a powerful work in the district in helping to make sure testing, treatment, resources, help, whatever you may need around HIV and other STDs. Metro Health DC is there to help you, as is STAR, Sisters Together and Reaching in Baltimore. And of course, we all know AIDS United. Raheem, take it away.
Well, you know, stigma gotta go. My name is Raheem Briggs. First of all, I just want to share with you a little bit about Metro Health Washington. Metro Health is a key partner with Project Briggs. Metro Health strives to build healthier communities, one person at a time. Their goal is to accomplish this by joyfully providing high quality health services with a commitment to excellence. So just want to, thank Metro Health for their partnership with Project Briggs. I am Raheem Briggs. I am the CEO of Project Briggs. And basically, our main focus is to support urban projects, cultural events, activities for diverse communities with the collaborative partnerships through our outreach. And so that's the key focus of our organization. And I am pleased and happy to be a part of today's panel.
Thank you, Raheem. Randy Woods, why don't you introduce yourself and tell us more about STAR?
Yes, thank you, Dr. Holton, for having me on the panel today, and I'm so grateful to be sharing this space. I am representing Sisters Together and Reaching, an organization that has been around in Baltimore City, serving men and women for 30 years. We'll be celebrating 30 years in March. I serve as the Senior Director of Community Care Coordination, and so when you say stigma gotta go and community is our superpower, those are I think what we live by at Sisters Together and Reaching, making sure that we create space and always looking back and reflecting on ourselves to say, how do we show up to create space that is stigma-free and inclusive of all communities? So I'm happy to be a part of the conversation today. Thank you so much.
Woo, thank you, thank you. Brother Andrew Teal, why don't you tell us about your organization?
Can you hear me? Hello, can you hear me? Okay, thank you.
We can hear you now.
All right, perfect. Sorry about that. Thank you, Dr. Hobson. Again, my name is Andrew Teal. I work underneath the Bennett Career Institute Foundation. Under that foundation, I work under the Allen products. So, particularly, my job is I make body butter, sea salts for dialysis patients for excess dry skin. The community for that is very small. They really don't spotlight it enough that kidney patients that needs like dry, like their skin gets really dry, like they need moisture, they need help, they need nourishment. So for my business, my job is to make sure they have the nourishment, they get the vitamins that they need, they get healthy over time with our products. Of course, like people that not even underneath kidney disease can also use it, but it's specifically for them. But I'm a product manager, and when it came down to this community bringing togetherness, it's certain things that be spoken about. So I'm happy to be here.
Thank you, Andrew. And rounding out our panel today, we have Valerie Rochester from AIDS United, Senior VP of Program and Strategy for AIDS United, another strong sister in the struggle that we've been traveling this path for a while together. Valerie.
Yeah, we have been doing this work for a little while, haven't we? I'm Valerie Rochester, and I have most recently been made Chief Program Officer at AIDS United. Just goes to show how long I've been doing this. And AIDS United is a national organization. We're celebrating our 10th anniversary this year. And our focus, our mission, our vision is focused on ending the HIV epidemic for people that are most impacted in the communities that are most impacted in the US. And the North Star that we use, that's the beacon and the guide for everything that we do, is that we center to the voices of people that are most affected, then the communities that are most affected, their lived experiences, their voices, making sure they're meaningfully engaged in the work. So that is the core of that, making sure we're uplifting those stories and those voices in all the work that we do. And we focus on grant making, giving funding to community organizations that might not ordinarily receive funding from foundations and the federal government and others. So we have a very low barrier approach to giving out funding awards. We do capacity building. We focus on evidence-informed interventions. And then we also have our policy and advocacy work. And AIDS United is the convener of AIDS Watch, which is the largest HIV activist advocacy event in the US. And this year it will be coming up next month, toward the end of the month. So be happy to share more information about that if we get to that. We're glad to be here.
So glad to have you here. And if you've never done AIDS Watch, it will look different this year because it's primarily virtual. But AIDS Watch,
it's all virtual.
Oh yeah, okay, it's all virtual. But AIDS Watch is that event that occurs every year where advocates for HIV storm the Capitol, and they go see those people who have the power to see that we get the funding, the resources, and the things we need to address HIV in our respective communities. And Andrew, I just want to say to you, you're making body butter and all those things to keep you lubricated. I'm just going to say, all this quarantining in the wintertime in the DMV, I think we all got a little dry skin and could probably use some of what you're over there cooking up. But today we're here to talk about All Boys Aren't Blue, an incredible production by iN-Hale Entertainment. And I tell you, iN-Hale Entertainment, you better plug them and put them on your radar screen because they are bringing out some powerful messaging that's not only entertaining, is educational with an artistic flair to it that you don't want to miss. But our mission today is to talk about All Boys Aren't Blue and what that means and why that's a powerful piece that helps us to share to our broader community that stigma is so much more than HIV. From my perspective, and in case you all don't know who I am, I'm Dr. Helen Holton, the Executive Director of the National Organization of Black County Officials. We're headquartered in Washington, D.C. Every time I approach my building, I see the Capitol looming ahead of me, and it reminds me that all politics are local, first of all, and the work that we do needs to get from where we are in our local respective jurisdictions to that Capitol, because that is where the biggest push of dollars, resources, and activism and advocacy makes an impact to where we are on the ground doing our work. So I want somebody to come on and tell me what you walked away with after watching All Boys Aren't Blue, a phenomenal dramatic reading of one young man's story.
I think for me, I was connected to the storytelling part where one of the brothers was talking about they were in a fraternity and how he felt going through that process and how, that brotherhood kind of reaffirmed his strength. We've all been in situations, where we're around a different audience where we have to feel like we have to hide who we are. And it's always that living in constant fear where we can't live our truth. I think for me, that just really brought it home for me to it's okay to live your truth. And that's important because that, when you live your truth, that enhances your mental health. A lot of times when we talk about mental health, people, in certain cases, people have mental health because they can't live their truth. And so that suppression causes other issues as well. So that was a powerful reading. That brought it home for me. So I was very taken back by that.
Thank you for that, Raheem.
I think to piggyback off of what Raheem was talking about how the fraternity made space, I was really brought in by Nanny, his grandmother. From a Black woman's perspective and how we hold space and how we recognize history. And it was very poignant things that she has said to him as growing up that made him feel comfortable and loved, right, and seen. And so as we're talking about stigma and stopping stigma, it's making sure that we acknowledge other persons. And that has to start when we're talking about community is power. The first community that we come to know is our family. And so really Nanny and the space that she created for her family.
Thank you, Randy. Andrew or Valerie?
Andrew, you please go ahead.
Okay then. Hello. Really, of course, the nanny kind of brought my attention. I'm also a painter, so just seeing the painting in the background, just seeing how they express their emotions and stuff, it's just that really drew me in. Mostly, it's just like the words and of course the surrounding of the areas. The stigma. I try to say my just a personal experience. Of course, the father is always never going to like it. So I have that type of father, verbal and physical abuse. So that is kind of like brought back a lot of emotions, and it's a very powerful piece. I saw it like twice, at least twice, just to get just an understanding of it, because I know you watch something for the first time and you just gotta think about it. I'm like, let me just go back and just like rewatch it. I get the understanding of it and the meaning, and it's really good. That's all.
So I want to bring this point up. I watched that film and I was grabbed by it from the very beginning. And seeing it tonight with you all this evening, it happened all over again for me. And I think what was most poignant is that his story about being a 5-year-old and having his teeth kicked out of his mouth, living in what was considered to be a middle-class Black neighborhood, so to speak, in New Jersey. You don't necessarily think about these things happening then, but they're very real. And how it shaped his life, because it built in him at an early age what it means to be different, even when he didn't understand what different meant then. So let's talk about when we think about stigma, because when I think about stigma doing this work, up until March of 2020, the only real thing I knew that stigma was infamous for in the Black community was around HIV and addressing it, protecting ourselves from it, and loving those who live with it. And then came COVID. And what I've learned in this year of COVID is, stigma, once again, must be a sibling to HIV, because both of these ailments are impacting our community more than any other. Your thoughts around that? Valerie, I'm going to pass the ball to you.
Well, I mean, it's not as if stigma ever went away. So, I think that's one of the things. It's always been present long before even HIV. I mean, any of the health conditions that affect Black people more than others, Black and brown people more than others, there's always been a stigma attached to it. Like, we're at fault, or we've brought this on ourselves, or there's something that we have had to be doing that wasn't quite, what other people expected or what other people thought we should be doing. So there's always been a stigma attached to any health condition where Black and brown people are most represented. So, there's that. It's been magnified with COVID-19. And it's in some cases, it's now just being brought to the forefront or being brought to the attention that stigma exists as around, health status, around ability to take care of oneself, the ability to make decisions about our own health and wellness, and our ability to access services. So, again, it's nothing new. We're just talking about it in a different way. And again, more people are focused on it now because of COVID-19.
I love that. And, it brings to mind for me, I have a family relative that even ever since I was a little girl, I always thought that he was a same gender loving person. See, I'm using the more accurate nomenclature in our community. And, it was always kind of whispered about. No one ever said it out loud. And I remember as an adult that, yeah, that's who he is. We all have something that defines us, who we claim to be in the world. But when you think about the people that hide their true self because of stigma, anyone else, what'd you take away from the film?
Well, you know, I go with the mantra, stigma gotta go. You know, each day, sometimes like, and when we grow up, people say that you're different. And what is different? Because we all are different. Doesn't mean that you have to fit into social norms, or what is the social norm? I think for me, what I got out of the film is we have to embrace who we are, and it starts there. However you identify. And I'm a firm believer, once you embrace who you are, then that enhances your mental health, because you become sort of like this force field that no matter what anyone says about you, when you love yourself, everyone falls in love with you. And that's just my opinion, because that's how I know I've always been different. I'm a loner by nature, but for whatever reason, I attract all this energy. I'm like, what? Everybody, you know, because I love myself, and I'm confident in who I am. And yes, I know that I'm a same gender loving brother, but that's just a small piece of me. I have so much. If you focus on what I can offer, you'll be like, wow, you won't look at me as, oh, that's, you know, this brother's this way. When we learn to love unconditionally, then let me tell you something, we'll be focused on getting to the next level. So it's really, for me, it's all about just embracing who you are, loving who you are, and being confident in your spirit, and building other people up. Even if they don't look like you, or built like you, don't speak the way you speak. You know, I come from an old school, treat people the way you want to be treated, and build people up, because this world will beat you down only if you allow it. But you also have to make sure that the people that you're around, that they're pouring into your cup as much as you're pouring into theirs. So.
Oh, I love that. I love that. And, you know, as you were talking, it reminded me the love and nurturing that I got from my grandmothers, both paternal grandmothers, man, nothing compares to the love of a grandmother, that they embody, at least my experience. That community really is our superpower. And it was through them and the unconditional love that they gave. You know, you get mad with your parents, you know, whatever it is, but you could always go run to grandmama, and she would know how to love you up and just make you feel like it's okay, baby. Community is our superpower.
And I would just add, Helen, when you're talking about community is our superpower, and putting that with what Raheem said, you know, a community that owns who we are, and can really look, when we start to be self-aware, it also allows us to begin to have some reflection questions, and to question things that we have been taught in our own culture and our own beliefs, and where did those things come from, right? And begin to break down, you know, because sometimes we may have stigma in our own, you know, in our own communities, but that self-reflective piece, and having a community that is very self-aware and has time, because I think being self-aware, you know, you have had a moment, the privilege to really look at yourself and ask those questions and feel safe in that space. And so I just wanted to add that point.
Yeah. And I just want to add that, you know, it's communities are our superpower, because people can belong to more than one community. Community is not one huge similar group of people. So, but with that, it's really going back to what you were saying, Helen, you know, how we grew up and what we know about who we are as Black and Brown people. And we have power, we have strength, we have resilience. And those are the things that we can tend to lose sight of in everything that's happening around us, when we see what's happening on TV and the latest, you know, murder of Black men in the street by the police officers, all of those things, we lose sight of the fact that we have resilience. And so when it comes to facing stigma, when it comes to addressing some of the things that are really impacting us most, it's drawing on those strengths that we have as Black and brown people and from the communities that we're part of.
Just to go off of everybody's opinion, because everybody's opinions is great, but I just to follow up on everybody. It's just I can only go off of my experience, I guess. It's just I know I accepted my community at a really late age, just because the stigma again, of course, of like I'm a general lover brother. I love my brothers. I'm not gonna lie, I do. But of course, when it comes down to respect for other people, of what I love and what they don't like, it's hard to find. How can I say it? The community create the stigma, but for me, I had to find a job to find the people in that community that accept me, and I think that transition was hard, because like you can be in a group full of people, but like everything's cool and dandy, but their mindset might be different than yours, and I was scared to jump out that circle to find somebody out the group that I want to be in. So I'm 28 now, and when I realized that, I was like 23, and it literally took me like a minute to figure out, is this good? Is this healthy? Like, should I like deny it or push it away? So what I just got from just the experience, and even this movie, community is important. You can't do stuff by yourself. You have to express it. You can't hold nothing in. And I guess I have to say, it's just like when it gets to that point where the stigma gets too hard. I know when I was younger, I was doing abusive stuff like drugs and injuring myself just to get that mindset out of my mind. I know if I have the right friends and circle group around me, they get my mind out of it. They say, you are beautiful, you are loved. You don't have to do this just because you love X, Y, and Z. You are great. So this is a follow up to everybody else. That's all I have to say.
Thank you for that. It's interesting as I listen to you, Valerie and Andrew, talk about community. And Valerie, I love where you said it's not one big melting pot of community, but there are many communities within our global community as Black people in America. I appreciate that, because every community doesn't hold the same value of who we are. And so we have to navigate the communities that love us and embrace us and bring us in. And in that, so when I think about community is our superpower, for me, it's the bigger piece. I know in the Black community, even if you don't like me, if somebody comes up against me, hey, don't mess with my sister, and you don't have to know me, but what you recognize is that common bond between us. And I think since 1619, we quickly began to realize when we came to these shores with different languages, but the common piece was we were brown people. And that helped us to build the community that has sustained us. So when we talk about resilience, and Raheem, when I think about resilience and I think about where you are building an organization and how you're leveraging what you've been able to do to keep your organization going.
I'm so glad that you asked that, point that question, because resilience meaning that, our organization probably has been running on a budget of less than $1,000. But it's the resilience, you would never know that, but it's the resilience in the work that our board as a group we do. We all put what we can together and we make Project Drinks work. The resilience of, you know what, we're going to make it happen. I don't care what it is. We, have so much support in Washington, D.C. We have, over 2,500 people that are on our mailing list. We do our part. And so when, resilience is a part of community as a superpower, because, when you look at when All Boys Aren't Blue was aired, all the little organizations came together and we used our little superpower. We had over 15,000 people viewed it that night. Okay. So it was just everybody coming together. You didn't have no big organizations with all this big $1 million, we all just say, you know what, let's get behind this brother George, you know, and why can't we use our little superpower and make it all come together? And so that's the resilience. You know, there's so much Black talent, Black LGBT talent out there. We should be doing the same exact thing. And it's always been my vision is, you know, to use our outreach and our collaborative partnerships to build on that and to build them on the momentum that we are a global family. We may not be in the same city, but we are a global family. LGBT, our community, that's the superpower. That's what we learn from it. And so the resilience that Project Briggs and the things that have been our challenge, we've been able to leverage those partnerships. And I definitely want to just give a huge shout out to Metro Health, because they have just gone out of their way to reach out to my organization, and we're going to do some great work. So the resilience for me is just to keep going, you know, just keep swimming, don't stop swimming.
You know, as you were talking, I remember the early days of Star. And Randy, you have to, when you said 30 years, I said, oh my goodness. I remember when Star was just this itty bitty organization looking to make a way in the world to support sisters in the struggle of health and healthcare and things of that nature. Share with us what resilience and community as a superpower means.
So, I mean, I am so blessed to do the legacy work that I do. My mom founded Star, and so I always look to Star as my little sister. And I mean, we've been resilient in times of funding, but I think that when I think about resilience, I think about some of our earliest persons that we were able to journey with, women who had families and kids, and you know, why Star even came to be was a place of saying, how do we leverage, right? When we talk about stigma, like how do we leverage the church where a lot of stigma was initially, right? To create this space, a healing space for women. And so really looking at the resilience of these women coming in contact with a virus at that time that, you know, they were journeying new space, like novel space, the same way we are now, but still maintaining their identity, showing up as mothers, showing up as partners, but also while they were going through that, recognizing that their brothers, heterosexual, queer, same gender loving, needed space as well. And so quickly making space for our brothers in the community as well. And so I think that that's what I think of when I think about resilience. I think about caring for yourself, but also being mindful to make space for others in your community that you have been in relation with and you say that you love.
Absolutely. You know, even with us talking about this, having this discussion after everyone seeing the film, you know, I just keep saying, as community, if it truly is our superpower, each of us in this discussion right now has a responsibility to tell others about this film, you know, because to look at it, all brothers aren't blue, all boys aren't blue. Somebody, well, what's that mean? What you mean all boys aren't blue? There's some people might start thinking about, oh, they must be talking about the popo. I don't want to see that. You know, come on, let's be real. Because when I first heard the title, all boys aren't blue. What's that mean? No, I don't expect all men to grow up and want to be police. You know, so it's incumbent upon those of us who see these wonderfully done stories and share them to help us understand that the struggle is real. The fight is ours to fight if we're going to bring our numbers down. You know, and it's not just HIV, it's not just COVID, it's heart disease, it's hypertension. I mean, it's all of these things. Valerie, tell us how AIDS United kind of tackles this in helping people, number one, to understand the stigma's got to go because it gets in the way of us understanding the power of our communities.
Yeah, you know, that's one of the key things around the work that we do with AIDS Watch, because the people that used to come to DC, but now meet online virtually for this event. They have such powerful stories that they're telling around how stigma and discrimination and lack of access and so many things have affected their lives and their abilities to live and be well. And when you think about it, it's stigma robbing people of their ability to be well. And that's something that nobody has any right to do or inflict upon somebody else. But the ability to live and be well should be a human right that is sacred. And when you look at something like stigma that affects that, and looking at where it has infiltrated almost every aspect of our daily lives, it's in our medical institutions, it's in our workplace, it's in our religious space or spiritual space and place. So looking at all of those different things and hearing the stories about how people are affected by this, but also how they're dealing with it. So they're telling the stories of how they're triumphing over stigma, either at the community level by taking on the stigmatizing practices of a local healthcare provider, about taking their stories to their local state legislators and talking about how the laws as they're written are not allowing them to have full access to the medications that they need, or to insurance, or to any of the housing, so many of the things that are needed in order for there to be this wellness that we should all have the ability to access. So looking at those hearing those stories and looking at the local actions that people are taking, and then elevating those, teaching others how to do that type of work. That's one of the key roles that AIDS United plays through our advocacy and our policy work. And then through the funding that we provide, it's supporting organizations at the community level where we're seeing most of these injustices taking place, and giving them the resources to make change in their communities around addressing not just stigma, but all of the social and structural barriers that are preventing them from having communities that are healthy and well.
Well, as we're winding down on our time together, first of all, I want to say to Raheem, Randy, and Andrew, I hope you're hearing Valerie. They help fund organizations doing this work. So make sure you do reach out to Valerie. They do great work, and a lot of it is about organizations such as those that you represent. In our last few minutes before we close, and I'm going to give everyone a final 15, 20 seconds to say who you are and your organization. And I'm sure we'll include your contact information somewhere along the way. I want to thank National Health DC for them coming on board to say, yes, this is powerful. We want to help sponsor this film and to tell this story of how stigma's gotta go, and that community is our superpower. And I'm going to turn it over to each of you, and I'm watching the clock. So Raheem, you want to go?
My name is Abdul Rahim Briggs. Once again, I'm the CEO of Project Briggs, and you can go to our website to learn more about us at projectbriggs.org, and you can sign up on our mailing list to learn more about us.
Randy, I'm just doing the little round robin.
All right. Hi, I'm Randy Woods of Sisters Together and Reaching. You can find out more about Sisters Together and Reaching at sisterstogetherandreaching.org. Thank you for having me.
Andrew.
Hello, my name is Andrew Till. I'm a product manager at Bennett C. Allen Products, and you can reach us at callenlifestyle.com.
And Valerie, take us home, honey.
I will do that. Valerie Rochester. I'm with AIDS United in Washington, D.C. And you can find out more about our grant making work and our AIDS Watch event at aidsunited.org. And registration for AIDS Watch is free this year because we're a virtual event. So you can go on and register for that. It's March 22nd and 23rd.
And everyone, we just are so excited that iN-Hale Entertainment continues to bring us valuable entertainment that educates us in an artful way. Stay tuned. They're coming up with more. You don't want to miss out. Sign up to make sure you're on that list when they launch their next production. Make sure you tell your friends, go see All Boys Aren't Blue. Go buy the book. George Matthew Johnson has a powerful piece of work that I promise you will add more to your conversation and how you talk about stigma gotta go, and that community is our superpower. Thank you for joining us, and we're glad you stayed tuned for the film and hope you caught this discussion. Take care, all.
Hi, my name is Rodney Chester. You may know me as Alex from Noah's Ark. With COVID-19 and all the health disparities that disproportionately impact our community, I've decided to get more involved in advocating for our rights to great health. I'm proud to be a mental health ambassador. Metro Health is a community health center in Washington, D.C. You all know that COVID-19 has held the world on lockdown for a year. The good news is vaccines are working. Get vaccinated today. Call Metro Health to find out when you can get your vaccine to protect you and your family at 202-638-0750. If you're not in the DMV, no problem. You can find a community health center near you by going to findahealthcenter.hrsa.gov. That thing, please wear a mask and go to the CDC for accurate info on the vaccine. Metro Health has some great resources on their website about COVID-19 vaccine. You deserve to be healthy and strong. Wear a mask.
I want this song to help shape the way America sees Black and brown boys. And I hope that when you listen to this, you'll understand where I'm coming from.
Too many times I had to apologize. Too many times I wish you got it, so I didn't have to wake up in the morning feeling like I'm never gonna be worth shit. Too many times I gave up my position. Too many times I gave you satisfaction, and now I regret it because I wasted my time and I'm not who you want. I gotta be true to who I am. I gotta be faithful to where I stand. I can be true to whoever knows me and really loves me for who I am. I might lose some friends unfortunately, but I'd rather be down for only me. Cause everybody tryna live a life that brings a little peace, yeah. Because all boys aren't blue, yeah. You see some boys they cry,